Hi, you might have read that headline about cholesterol in your thyroid and wondered, what in the heck is this lady talking about? So let's talk about it a little. Something that I find routinely in my clinical practice is that people will come in and their cholesterol is high or borderline high. And they have been told, oh, you need to change your diet, we need to really watch this, or, then we're going to have to think about something like a statin drug or something like that, is what their primary care doctor tells them. And they might run a TSH number on their thyroid, and they look at that labs and they say, well, your thyroid is fine because everything's in the reference range for a TSH number. But let me tell you a little bit about how the thyroid and and cholesterol are related together, so you'll know what's happening. When I see a borderline high cholesterol or high slightly elevated cholesterol, and I say up to 250 or something like that, and then I go and I look at TSH and I see that it's 2.5, 3, 3.5, somewhere in that range, that would be considered subclinical hypothyroidism. And that just means that it's not high enough to get somebody diagnosed with a thyroid problem, but it's high enough for me to take notice as a functional doctor to say the thyroid is struggling. The functional range for a TSH is between 1 and 2.0. And so when I see someone higher than that, 2.5, 3, in that range, and then I see the cholesterol, I go, well, yeah, there's a connection here. I see that quite a bit. And let me explain what happens. When your TSH number goes high, that's called thyroid stimulating hormone. That just means that your body needs more thyroid hormone. And in order to get that, it ups something called thyroid stimulating hormone, which sends a message, hey, I need more thyroid hormone, create those. So when TSH is high, the other thyroid hormones are relatively low because you don't have enough of them. So that's your body's way to try to create more, get you to stimulate more thyroid hormones. So when that happens, something called HMG-CoA reductase, it's an enzyme that gets involved, and that creates higher cholesterol. It's done in your liver. So your liver is what synthesizes cholesterol. But higher TSH levels stimulate that enzyme, which stimulates the production of cholesterol. So that's kind of this cycle, and so many times the real root cause of cholesterol is the thyroid. But it's not an issue that most doctors are going to address because it's subclinical. Again, it wasn't like a glaring red flag of, oh, this is out of the reference range, so we're going to put you on a thyroid medicine or something like that. It's just above the optimal, but not enough to flag on a conventional test. So that's the difference between the way functional doctors read labs and most mainstream doctors read them is, there's a much tighter window in functional medicine of looking at what makes someone healthy versus what's a glaring disease process. So then we look at supporting the thyroid and figuring out why the thyroid is struggling. We do that, and then the cholesterol will normalize as those enzymes come down in the liver, and the TSH comes down, and all that stuff. I see it again and again and again. And there are some scientific studies, and if you want to look at that, I put, if you read the blog article, there's all that's in there. So if that interests you, you can go and use that as a reference. But I just wanted to explain that because there's a lot of, I think there are a lot of people walking around, their cholesterol is related to their thyroid. And unfortunately, sometimes they get put on these statin medications and then they just feel terrible because the side effects of statins are, joint pain and tired, achy muscles and things like that. So there's some pretty significant side effects. So I hope you found that interesting, and thanks for watching.